Good morning and welcome to our presentation. This is Shedding Light on Cancer Rehab. This is our service on breast cancer. So this presentation was sponsored by Florida Physical Therapy Association. They have provided the funds through a grant to educate the community on what physical, occupational, and speech therapy, along with massage therapy, will do for the community, specifically cancer rehab and cancer patients in the community. This is one presentation of a series of 5 of them, and today we'll be talking about breast cancer specifically. We are here from Be Strong Therapy Services. I am an occupational therapist. My name is Kelly Juanino. I'm also a certified lymphedema therapist, oncology rehab certified. With me are my 2 business partners, Megan Bradley, Doctor of Physical Therapy, certified lymphedema therapist, oncology rehab certified, and Dr. Amber Swords, physical therapist, Doctor of Physical Therapy, pelvic floor therapist, and background in neurological rehab. We started Be Strong Therapy Services. We provide the community with one-stop place for cancer therapy to address the entire journey a patient goes on through their cancer treatment, from diagnosis through treatment and back to quality of life. We are located, we just moved to our new building on just off of Thomasville Road here in Tallahassee at 1414 Piedmont Drive. We now have 7 treatment rooms, we have a massage therapist, and we are looking at continuing to add services to our new location. I am going to hand this over to Megan Bradley, and she is going to talk about this next slide.
Okay, so this is kind of a little bit about the type of services that we offer. All of this is centered around the person that has had cancer. So specialized physical and occupational therapy to help you return to everyday activities. So let's say you might have had a mastectomy and now you can't lift your arm as well as you could before and do your job like you could before. So physical and or occupational therapy could help you get back to doing your job like you did before your breast cancer surgery. And then once you finish with physical or occupational therapy, you might want to continue with us because you like fitness and you like kind of what we do. So we do offer personal training services to help you get back to just being more active or as active as you were before your cancer diagnosis. We also, now that the pandemic is hopefully on the downward trend, we are going to be adding back in our group exercise classes tailored to the cancer survivor. It'll be a combination of Pilates and yoga, focusing around improving your posture, balance, overall strength, and that way you can do it in a group setting. It's a little bit cheaper, and then you will be able to kind of enjoy that type of exercise again with someone who is knowledgeable in cancer. And then we also have, we try to tailor all of our therapy services to the client themselves. So we offer massage. We will come to people's houses if needed. We try to really take an individualized approach to therapy. So these are some treatment options that you might be presented when you are diagnosed with breast cancer. Sometimes people start and they have surgery to remove the cancer in their breast. Some people start with chemo first. This depends on the type of cancer. And then most likely radiation towards the end of your treatment. So there can be some complications from any of these treatments to improve your cancer, hopefully heal it. We're going to be talking a little bit about each one. So this is just a list. So lymphedema or swelling of your arm or breast, cancer-related fatigue. So that's kind of, most people know that you'll get tired after chemo or radiation. So this is an actual diagnosis that exercise can help with. Axillary Web Syndrome, we'll be going through that in a little bit more detail, but it is really tight rope-like veins down your arm that can really be painful. Peripheral neuropathy, numbness and tingling, decreased arm strength, and decreased range of motion can all happen after any of the treatments that was listed on the other slide. Okay, so I'm going to hand it back to our other lymphedema specialist, Kelly.
Thanks, Megan. All right, so one thing that people ask us, women ask us about after their, well, sometimes before actually, their diagnosis with breast cancer. So women have a tendency to be afraid of this condition, this diagnosis of lymphedema. They've heard the word, they've heard the term, they've seen somebody who has had breast cancer, has had surgery and radiation, and now they've developed this swelling. And it's, you know, they don't have a lot of information about it, but you can see that it would be kind of upsetting or scary. So one of the things we want to do is talk about, is somebody actually at risk for development of lymphedema? How do we decide that somebody's risk for lymphedema is increased? And then most importantly, what you can do to either prevent the onset of lymphedema, or once that started to happen, how do we kind of get your body back to a healthy state and deal with that? So the number one question we get asked is, am I at risk for lymphedema? The answer is somewhat complicated, but we narrow it down to these things. One, anybody that has had trauma, has had surgery, has had lymph nodes removed, has had radiation, is at risk for lymphedema. Studies vary on what that risk looks like percentage-wise. Anywhere from 5% to 50% of women who have had breast cancer and had surgery and radiation are at risk for developing lymphedema and will develop lymphedema. It gets complicated because surgeries have improved so drastically over the last few years with technology like only doing a sentinel lymph node biopsy, where they take a smaller portion of those lymph nodes, more targeted radiation therapies, and technology like the arm, where they inject dye and remove only the lymph nodes that are associated with the breast tissue and leave those lymph nodes that actually drain the arm. So those statistics are slightly off just because of the complications that come with the diagnosis and treatment of breast cancer. The things that we do know add to your risk for development of lymphedema are a body mass index of greater than 30. So any woman that comes to us and you know, we take her height and weight and look at overall health, and their body mass index is greater than 30, we should be counseling these women on how to improve their overall health, how to get their body weight to a healthy place under 30 through exercise, through, you know, healthy eating habits. I like to avoid the word diet because that has negative connotations and can mean some kind of radical things, but healthy eating habits. Another thing that adds to your risk of development of lymphedema is radiation to the axilla or the armpit and chest. So through surgery, many times a surgeon will remove lymph nodes as part of treatment for breast cancer in order to rid the body of known cancer cells. And then radiation in that area can cause damage to the remaining lymphatic system in that area, as well as kind of hardening and causing those remaining lymph nodes to become fibrotic. Post-operative infection. A lot of times we see seromas, which is a pocket full of fluid. We do see people who have post-op infections. So for one reason or another, their body will continue to produce extra fluid. Drains will stay in longer. We all know that anytime we go under surgery, there's a risk for infection. Although this does not happen often, it does increase a woman's risk of developing lymphedema down the road. Another thing is the more lymph nodes that are removed, as in the case with an axillary lymph node dissection, where they remove all of the lymph nodes from that armpit or axilla, then that increases, obviously, the woman's risk of development of lymphedema down the road. We like to really try to focus on some positives and some of the things that give power back and give control back to a patient who's been diagnosed with cancer. So while we talk about risk and while we talk about some of the things that can happen after a diagnosis with cancer or breast cancer, we like to really focus on things that you can do that minimize your risk for complications and help you focus on having a healthy body and having, improved quality of life after your breast cancer diagnosis. So some of the things we really focus on in therapy is maintaining good skincare, hygiene, trying to, in a healthy way, get women's body mass index down and back into that healthy range. So what does an exercise program look like? When should you be exercising? How much exercise should you do? We know that one of the best things that we can do for somebody who's been diagnosed with any type of cancer is get their body mass index to a healthy range and get them exercising and living a healthier lifestyle. It's especially important for breast cancer survivors because adipose tissue or fat creates estrogen. And for those estrogen-based breast cancers, what you really want to do is get somebody's adipose tissue or fat into a healthy range. It really reduces the reoccurrence for breast cancer. It also reduces a woman's risk for development of lymphedema. So we have a few specialized exercise programs that have been studied in women with breast cancer and are specific to that population. All right, so I'm going to let Amber talk about cancer-related fatigue, the number one side effect that we hear about and is reported with all types of cancer, but we see very frequently with our breast cancer survivors.
Yeah, so just like Kelly said, this is a common complication or side effects that we see. Pretty much every one of our cancer patients that comes in is complaining of fatigue in some form or fashion. This is something also that can last after you are finished with treatment. So if you've got chemo or radiation, this is something that can, be a long-lasting effect following those treatments as well. There are so many really good studies that say that exercise has been shown to improve and reduce cancer-related fatigue. So this is something we at Be Strong can really help you with. I am a certified personal trainer as well. So this is something that we try to have people continue to exercise following, even following their chemotherapy and radiation treatment. Little small things that people can do. A lot of people don't feel like getting up and getting moving. It seems like the last thing that you would potentially want to do if you're going through chemotherapy. But there are so many good studies that say that this is really important. And we have, tons of women breast cancer survivors that have said how much exercise has helped them throughout this whole process. Starting slow is the key. Just getting up and getting moving is very, very helpful in, reducing the amount of fatigue that you're going to experience through cancer treatment. So our next slide is on Axillary Web Syndrome, and this I'm going to hand over to Megan.
Okay, so on this slide, you can kind of see what axillary cording or Web syndrome looks like. A lot of people say it looks like a very hardened vein or kind of piano wires, and it can start in the armpit or breast region and go all the way down into the fingers. Some people have a continuous cord. Some people have cords just in their armpit region. Some people just have them in their fingers. Most of the time you can see it when you're lifting your arm over your head, usually above shoulder height with your arm outstretched. And then it's less noticeable when your arm is at your side. It can be very, very, very painful. And sometimes just moving your arm, especially in that direction, is going to be hard to do because those cords are going to be really tight. So the best thing that you can do is do some stretching and then also come in for therapy. And usually within a few sessions, we can greatly reduce your pain by performing some hands-on techniques that break up the cords, and then we'll teach you some stretches that you can do at home. And usually within a few sessions, this can be taken care of and you're going to feel a lot better. But it's just good to know about because it's not something that you're going to be, have something very long term, but it can be so painful. And a lot of people just don't know that there can be anything done for it. So it's good to be aware of it, get in to see a therapist, get stretching exercises, and then hopefully you'll be a lot better off. Okay, so peripheral neuropathy is basically numbness and tingling in fingers and toes. It's a very common side effect after chemotherapy. Some chemo drugs are more, you're at more risk if you have those types of chemo drugs than others for peripheral neuropathy. A lot of times because people can't feel their feet as well, their balance and their fall recovery strategies are going to be lessened. So it's important. We can't necessarily fix the peripheral neuropathy itself, but we can assist with helping you to regain your balance and different strategies to prevent falls, desensitization exercises so you're not having that numbness, tingling, pain, and you have strategies to kind of get out of the pain, and then strengthening and stretching for both the hands and the feet to help with improving your overall dexterity. A lot of times there is some medicine that patients can be prescribed to improve their peripheral neuropathy, but sometimes that's not enough. You still have those balance issues or hypersensitivity. So this is something we can definitely help with. I'm going to hand it back to Amber, and she's going to talk about strengthening of your arm and after breast cancer surgery.
So another complication that we see following breast cancer is decreased arm strength and range of motion. Following surgery, you can have a tightening of the muscles around the area that was removed. And that often causes limitations for people to be able to, let's say, reach in their cabinet or, do things that are overhead activities. And a lot of women with breast cancer don't know what to do or how to get that range of motion and strength back. And a lot of people just want to kind of keep their arms straight down by their side to try to minimize any pain that would occur. They don't really know how to progress to regain all of that range of motion and strength. Scar tissue massage and stretching program can help to improve pain and improve the ability to reach up over your head. I'm going to hand it back over to Kelly, and she's going to tell you a little bit more about the Strength ABC program.
I would like to add to the sort of post-operative shoulder limitations and just very quickly address the reconstructive surgeries. So there are many reconstructive surgeries, and some are immediately upon post-mastectomy. So a woman will have, expanders placed during the process of having her mastectomy. And what type of exercises, what type of arm movement, how frequently she can do those things depends on those reconstructive surgeries. We have patients who will have a latissimus dorsi flap. So that is a muscle that is located sort of on your back shoulder blade area. And a physician will take a portion of that and make a breast tissue. There's tram flaps. There are all types of reconstructive surgeries. And depending on what type of reconstructive surgery a woman has and where she is in the recovery phase really tells us what type of arm exercises, range of motion, and strengthening program she should be doing. We actually have a protocol for each one of those reconstructive surgeries with stages. So it's important that when you're doing these, that you know where you are in the recovery phase, post-surgery, and then what is appropriate for the type of surgery you've had. We like to work really closely with our general surgeons, but also the plastic surgeons because there are limitations and time frames that we need to follow. So then that gets us into the Strength ABC. Strength ABC is Strength After Breast Cancer. It's a program that was put out by the University of Pennsylvania. It was studied by the University of Pennsylvania. We know that exercise is great for women who've been through breast cancer, a diagnosis with breast cancer, and are recovering. We know that we need to get these women into strengthening programs. We need to address their body mass index. We know that these women are eager to live a healthier, more active life after this diagnosis. But what does that look like, and what's the right amount of exercise? How much? What should we be doing? And how do we limit the risk for development of side effects like frozen shoulder or lymphedema? So this program was developed specifically for women who've been through treatment for breast cancer. They studied women who have not yet developed lymphedema, who have very little risk for lymphedema, and those that have actually developed lymphedema. Developed this program. It's a program that we as physical and occupational therapists need to go through a certification for, and then we are able to disseminate that to our patients. The reason being is that there can always be some, repercussions. We all know people who've gone to the gym and kind of hurt themselves because they didn't really know what they were doing. So it's really important that somebody know where their patient is or the client they're working with is in their recovery process, what their limitations are. And, we start on this journey together to work through a program that's specifically targeted for women who've had a diagnosis of breast cancer. And then this is where Amber's really shines, and I'm going to hand this back over to her.
So a lot of women going through breast cancer treatment can have pelvic pain and not really think that that pelvic pain is not necessarily associated with the treatment. I don't think a lot of physicians kind of think about the pelvic part of it because they're sort of trying to, maintain someone's life. And so with the pelvic pain, you can also have vaginal dryness because of the hormonal changes that occur during breast cancer treatment. Like we said, pelvic pain. You can also have pelvic floor muscle tightness, and this tightness can contribute to that pain. So it's sort of this cycle with dryness and tightness contributing to pain. And just like we talked about, hormonal changes from treatment can cause a lot of issues that, aren't really well known. So there are vaginal moisturizers that women can use to help combat this, as well as personal lubricants that can help to decrease some of the pain during intercourse. So, it's really good to sort of dive into this part of it too, because it's an issue that a lot of women don't want to talk to their physician about or don't feel comfortable talking to them about. So we can definitely help in this area as well. So this is just our new location. We have moved, we've been there for about a month now. We are really trying to create a calm, healing environment where people feel like they can come and just kind of be taken care of. We have a little coffee and tea bar, and we try to make people feel at home and provide really great care in a really beautiful environment. We have balance certifications, cancer, lymphedema certifications, pelvic floor training, vestibular rehab training. So we're really trying to create sort of a one-stop shop for cancer rehab, where we provide you with all that you need to help you go through your cancer diagnosis.
Okay, so that's all we have for our presentation today. Thanks for anybody who came and listened to our presentation. We will be having another presentation in July on head and neck cancer. That is Friday, July 16th. So we'll be talking about different types of therapy and how it can help you when you're going through head and neck cancer treatment. And then our next one after that is going to be in October. We'll have a lymphedema support group, and we'll also be doing more on the pelvic floor on October 8th specifically, and how that can help you through any type of cancer that you might be going through, specifically women, most of the time women's cancers, but also prostate cancers as well. So we hope you join us, and thanks for listening today.